hematology oncology, heme synthesis, porphyrias, and lead poisoning. All right, so up next is our heme synthesis pathway as well as porphyrias and lead poisoning that we need to understand. I already discussed lead poisoning in other videos, but just to touch on it again, when we have lead poisoning, the affected enzymes are going to be ferrochelatase, right, and ALAD, right? And accumulated substrate is going to be ALA as well as protoporphyrin. Now, the main presenting symptom is going to have mental deterioration in child that's exposed to lead paint. And for adults, we're going to see headache, memory loss, and demyelination. You can also have that constipation associated with adults. They're going to have microcytic anemia, basophilic stippling in peripheral blood smear, and then ringed sideroblasts in bone marrow, which we discussed already, but make sure to differentiate that for yourself. Basophilic stippling is going to be in the peripheral smear, whereas ringed blasts are little red blood cells, so that means they have to be found in the bone marrow. Okay, so that's why our ringed sideroblasts are in the bone marrow, and our basophilic stippling is going to be found in peripheral smear. Next is acute intermittent porphyria, and the way that I separate this out, in contrast to porphyria cutanea tarda, PCT, is that acute intermittent porphyria, or AIP, has the symptoms of painful abdomen as well as port wine colored pee. And so I tend to clump all the P's together, and this is how the book does it as well. But if you have porphobilinogen deaminase deficiency, that's the enzyme that's deficient, you're going to have a buildup in porphobilinogen as well as ALA, and you're going to get that port wine colored pee with painful abdomen. Okay. Now for PCT, obviously, porphyria cutanea tarda, it has cutanea in the name, so you know that it's going to have some type of photosensitivity and hyperpigmentation, and that's exactly what happens. So if you ever see anything that has hyperpigmentation or photosensitivity, you know that you're dealing with PCT. And they love to ask about the affected enzyme. UROD is the best way that I remember it, but you have the full name right there in the book, as well as the presentation of tea-colored urine. Okay, so don't get confused with that. They like to maybe ask the association with Hep C, but it really isn't that high yield. And alcohol consumption as well can exacerbate it, but once again, that's not too high yield. So just a quick overview, lead poisoning, what we need to know is ferrochelatase with ALAD is going to be the enzyme, and you're going to have the mental deterioration that we need to look out for with the microcytic anemia and the basophilic stippling with ringed sideroblasts. For acute intermittent porphyria, you have to understand that porphobilinogen deaminase is the issue, and it leads to the symptoms of the painful abdomen and port wine colored pee. And then lastly, the PCT, porphyria cutanea tarda, you have UROD deficiency, has tea-colored urine, but what they love to ask about is that photosensitivity and hyperpigmentation along with that alcohol consumption.